Yo, it's 6, a little after 6, and just finished a workout. It's rare that I'm able to work out by myself nowadays, and I'm blessed to have a great workout group. But with the weather, ended up being that I was the only one at workout today. And after finally finding some motivation, I was able to get a good workout in. And when I'm by myself, a lot of thoughts go through my head, and things that I want other people to know, and then I worry about educating people versus being offensive to people. Sometimes I have to decide if it's more important to educate than to be offensive. So I think this is one of those times. I'm blessed to see a lot of patients in all of our offices, and in certain offices there's a population of kids that are in rough shape. And yesterday was a great example. I saw an 8 or 9-year-old just cute as a button, just a little princess, and she had 10 adult teeth so far, 10 or 12, and half of them had very large cavities. One of them, cavity into the nerve, and was getting infected. Just breaks your heart. And I see it a lot, we see it a lot, and you know, in conversations with the parents or grandparents, whoever's ultimately helping out the situation, everyone keeps coming back to soft teeth, and well, her dad's got soft teeth, or her mom's got soft teeth, or she's destined to have lots of cavities because that's what goes on in our family. And you know, to be honest with you, I used to placate parents that said soft teeth, because in dental school, you're taught that there's no such thing as soft teeth. But to be 100% transparent with you, more and more research is coming out that the teeth themselves aren't necessarily soft, but people have different saliva or spit makeup that can predispose these individuals to be more cavity prone. And in people's minds, that translates as soft teeth. So at the end of the day, it is what it is. It doesn't really matter if it's soft teeth or if it's a different salivary makeup that's causing these increased cavities. But I think about this all the time, right? So it's Stoicism 101. It's the serenity prayer. You have to control what you can control and let go of things that you can't. So if you do have soft teeth, if you do have this genetic predisposition for more cavities because of your saliva, if you are type 1 diabetic, if you don't have fluoride in your water, all of these things you can't control, okay? So just stop thinking about those things. You have some strikes against you, so to speak. But now you have to ask yourself, what can you control? And then let's frame this with this little princess that I saw yesterday. So let's say she has soft teeth. Let's say that her dad gave her genetics that her spit is more cavity prone. Okay, it is what it is. But now we have to do some other things to combat that. You already have a strike against you. What can we do now? What can we control? Well, we can control her diet. We really have to figure out how to get less sugar in her diet, less sugar on her teeth, okay? We can control her home care. You know, there's the excuse that there's not enough time to brush twice a day. It just blows my mind. You know, the average American scrolls on social media, has their iPhone or their smartphone 4 to 5 hours a day. You're telling me that we can't find 2 minutes in the morning and 2 minutes in the evening to brush and floss your teeth? Like, again, I worry about that borderline of being offensive versus being educational. And I apologize if this is coming across as offensive. I really do. But, okay, we have the soft teeth. Move that over there. That's no longer an excuse. It is what it is. Okay, you can't control that. But we can control diet. We can control the level of our home care. We can control how well we do our home care. We can control our fluoride exposure. Yes, you may live in a community that doesn't have fluoridated water, but you can go to Wegmans or Walmart and buy a $3 bottle of Act Fluoride and either you rinse with it or have your kids rinse with it for 30 seconds. Brush your teeth well. Rinse with fluoride for 30 seconds in the morning. Brush your teeth well. Rinse with fluoride for 30 seconds in the evening. Monitor your sugar. I'm not suggesting to stop eating sugar. I love sweets. I love chocolate. I have an infatuation with chocolate that is unhealthy, okay? But I don't eat it all day long. I have episodes of time where I'll eat it, and then when I eat it, I go and brush and floss my teeth. Like, those little habits allow me to not have cavities, okay? Now, I don't have soft teeth, so I don't have to deal with some of the other things that you have to deal with. But you do have soft teeth, or you do have a genetic predisposition for cavities. Like, now what? Now what can you do? So please think about that. Please think about what you can control, the serenity prayer. God, give me the peace of mind, the understanding to control what I can control, to not think about what I can't control, and the courage to know the difference, right? So now that you know you can control your diet, you know you can control your home care, you know you can control your fluoride exposure, do those things, especially for your young kids. So that's the first thing. And then the second thing, 2 weeks ago, I took out 18 teeth on a 31-year-old. A 31-year-old mom. Her teeth were very far gone. She grew up in an area that didn't have fluoride in the water. She had soft teeth, which in retrospect, I think she probably had a salivary predisposition for more cavities. And she was pre-diabetic, uncontrolled, which led to lots of periodontal disease. Long story short, she ended up losing all her teeth and I had to make her dentures, okay? When she got picked up from her sedation appointment, her loving husband, and I could tell he loved her, like unconditionally. It was awesome to see. Comes in to pick her up, and there were 2 kids in the car. One was 7, one was 5. And it breaks my heart to think that the mindset may exist that this is just a familial thing. So the mom had dentures at 31. The mom lost all of her teeth at 31. The kids are destined for that. Like, at a certain point, we have to break the cycle. At a certain point, we have to control what we can control and not use the things that we can't control as a crutch, okay? Yes, you have soft teeth. No, there's no fluoride in the water. Okay, you can't control those things. But what could you do in terms of educating your 5-year-old, your 6-year-old, your 7-year-old, your 8-year-old to break the cycle so they don't have dentures in their 30s like their mom and like their mom's mom and like their mom's mom's mom? Like, it's all about little habits. It's all about breaking the cycle. And I beg you to consider breaking the cycle. It's little behavioral changes daily that will allow these kids to break the cycle and grow up with a nice, healthy, full complement of teeth and lose this mindset of, it's not a big deal. My mom had dentures at 31. Maybe I can make it to 35. Like, please, I beg you, consider breaking the cycle. All right, guys. Again, I apologize if I was offensive. I certainly wasn't trying to be. I just want people to understand that there's certain things that you can control and there's certain things you can't. You can't control your salivary makeup. You can't control if you have soft teeth. You can't control if the municipality or your village decided to take fluoride out of the water. But there's so many things that you can control. All right, love you. Reach out to me if you have any questions or concerns.